Yes, I'm ready.
Both are ready?
Yes, ma'am.
Okay. So if you've read and understood, considering it communication skills station, please begin.
Hi, good morning.
Good morning.
My name is Dr. Alam Al-Huda, Senior House Officer, working for Mr. Man in the Royal Hospital, calling to speak the on-call consultant surgeon. Can I confirm that I'm speaking to the call consultant?
Yes, yes.
Thank you for your time. I
Okay.
have a fragile lady. She has no case of COPD and mild left ventricular hypertrophy, and she is post-operative day 2 following mastectomy and axillary lymph node clearance because of breast cancer. The patient developed axillary swelling, and the wound suction drained about 410 ml of fresh blood, and also the patient experienced shortness of breath. The problem is that her daughter want to take the patient, which is her mother, to home, which is about 60 mile away, and I will spend about 20 minutes try unsuccessfully to convince her that the scar today is not in the patient best interest, but the daughter and the patient are insist to go home. So I will call to take your advice.
Okay. Do you think this patient made her own decision, or she was bullied by the decision of the daughter to go home?
Yes, I think the daughter confronts her mother that is best for her to take her home today, and the patient preferred to go has one home when she is well enough to go home.
Okay. The patient, do you think the patient is alert and can make her own decision?
Yes, the patient is alert and oriented, and she is competent to take the informed consent.
Okay. What do you think has happened to this patient?
Okay, as the patient have axillary swelling and bleeding at the site of the surgery, I think the patient have reactionary hemorrhage or bleeding, and as the patient have shortness of breath, and suspecting that she has pulmonary or venous thromboembolism, I think the patient develop pulmonary embolism.
Okay. You talked about bleeding. What would have been the cause of this bleeding?
Okay, the bleeding could be due to sleep clips, or it could be to injury of the arteries.
Okay. What do you think about the shortness of breath? What do you think could be the cause?
I think the patient may have pulmonary embolism, or as she known case of COPD and mild left ventricular hypertrophy. It could be due to COPD flare or due to heart failure.
Okay. So, what about the axillary swelling? What are the causes? What could be the cause?
It could be due to lymphedema, or it could be due to axillary venous thrombosis, or it could be due to bleeding from the arterial due to split of the clips or injury to the vessels.
Okay, doctor, with everything you've told me now, can you tell me what will be your plan of management for this patient?
Okay, first I will inform that patient and her daughter that the scar today is not in the patient best interest, and if they insist to go home, then I will lead her to sign a legal document stating that she is want to discourage it against medical advice, and she is aware of all the complications that may occur, and she is taking the responsibility of all adverse effects that may happen. And then after that, I will tell the patient about the warning signs and symptoms that she must look for out. And if the patient develop increase the bleeding from the wound side, or increase the shortness of breath, or she is become generally unwell, she must seek medical advice by visiting a near hospital or come back here.
Okay. What about your management currently? Because you made mention that the axillary swelling could be due to bleeding and the shortness of breath can be due to pulmonary embolism. So how will you manage this complication?
Okay, regarding the bleeding from the side of the surgery, I will order the complete blood count. I will look for the hemoglobin for the continue of bleeding. And for the hematoma, I will evacuate it later on. And for the shortness of breath, as I suspect in pulmonary embolism, I will order CTBA to rule out or confirm if there is a pulmonary embolism, and then manage the patient accordingly.
Okay. Do you think she's stable?
For now, yes, she is stable, but as I suspect in pulmonary embolism because the patient she has shortness of breath, so I can't discharge her now.
Okay. So what will you do if the drain is 400 mils?
Okay, first of all, I will not remove the drain. I will let the drain in the place. And then after that, I will teach the patient how to take care of this drain. And if the fluid become less, she can remove it by visiting the near clinical or near hospital. And I can involve also the community nurse in that.
Okay. Okay. No problem.
Thanks you for your time, doctor.
All right. Thank you.
What is this community nurse going to do?
The community nurse, as she is want to discharge it against medical advice, and she is insists to go home, the community nurse can come to the home of the patient and look for the drain. If it is displaced or increase the bleeding from the drain, she can change the drain or take care of the drain by the washing the drain or cleaning the drain. Or if the fluid become less, she can remove the drain, the community nurse.
Okay. All right. Okay. What investigations would you ask for in order to ensure that she is not suffering from pulmonary embolism or deep vein thrombosis?
I will order the CT pulmonary angiography, which is the gold standard for the pulmonary embolism.
Yes, and?
The dimer, the
Okay.
chest X-ray, ECG.
Yes. Okay. Any other, did you mention arranging physiotherapy for the chest and
No,
contacting medical registrar
no,
with the
I don't know.
suspicion? Yes, you have to remember these as well. With regard to pulmonary embolism and deep vein thrombosis. So you have to do this because chest exercises, which physiotherapist will help, it will help patient breathe in. Okay, good.
Is
Thank
for
you.
investigation or for the management?
Investigation and management, because you were asked how are you going to take care of these complications.
Okay, okay.